Good morning, everyone. I'm sure you're having an exciting session up till now. We start with scientific session 3, Foraging the Context of Occupation. For this session, we have Chairperson Dr. Shailaja Jayavant, who is a faculty in occupational therapy for more than 26 years. She's been guiding postgraduate students for the past 20 years. She's a recognized PhD guide and an associate professor at MCGM Studies at St. J.S. Medical College, affiliated to Mumbai University. She's published more than 30 research articles in various journals, and she's been the faculty for workshops in developmental care and neonatology. She received the fellowship of All India Occupational Therapy Association and has also been the faculty for fellowship program in developmental disabilities. Our second esteemed chairperson is Dr. Punita Solanki, who is the professor at D.Y. Patil deemed to be University School of Occupational Therapy. She has worked on a pioneering program from May 7th to 2022 to October 31st, 2022 at National Institute of Physical Medicine and Rehab, College of Occupational Therapy, Kalattam Kara, Thrissur, Kerala. She is a teacher and a dissertation guide for undergraduate and postgraduate students of occupational therapy for the last 12 years. She's authored 2 books on multiple choice questions in occupational therapy and has 20 national, international journal publications, editorials, 1 conference proceeding, and 1 national guidelines project. She is a fellow of the Academic Council of Occupational Therapy in 2018 and received the AIOTA's Professional Excellence Award in 2019. We welcome the guests and we will start the presentation. Again, we all know that it's going to be for 10 minutes. At 8 minutes, there'll be a timer, and at 10 minutes, please restrict cross-questioning, since we're a little devoid of time.
Good morning, everybody. So we are starting with scientific session 3, Foraging the Context of Occupation. Here we start with the first speaker. Her topic is Association of Emergence of Hand Preference and the Child Development. Dr. Harini D. from Bangalore.
Good morning to the judges and everyone present here. This study. So good morning to the judges and everyone present here. This study is about the association of emergence of hand preference and the child development. Introduction. Development of hand preference is important as it helps in improving the strength, precision, dexterity of the preferred hand, which further enhance the child's play, performance ability, that is the skill, in their essential day-to-day activities. Hand dominance as a laterality index represent the structural and functional asymmetry of the brain hemisphere. Children with autism spectrum disorder have a different pattern of hand preference as compared to the typically developing children. So that is, they have a delayed hand preference development, a higher rate of left-handedness, approximately 15 to 20%, and a higher prevalence of inconsistent handedness, approximately 44% have been reported in ASD children. So research showed that the ASD children with inconsistent hand preference displayed a poor performance in both expressive and receptive language domains of development. So each domain of development facilitate and support the learning and the growth of the others. Conversely, conversely, a delayed development in one domain has an impact on the development of the other. So keeping this as a foundation, our study aims to analyze the relation between the emergence of hand preference and the developmental domains in children with ASD. So the method, the study design is a cross-sectional study, and the participants were recruited through the convenience sampling based on these criteria. So the inclusion criteria is the children diagnosed with autism spectrum disorder aged between 3 and 6 years. And the exclusion criteria is the children with any other neurological disease, learning disability, developmental coordination disorder, visual impairment and physical impairment were all excluded from the study. Standardized test that was used in the study was modified Edinburgh handedness inventory, as it was chosen as a commonly used handedness inventory to assess the hand dominance in children with ASD. And the items were scored 1 if the item task was completed with a clear hand preference and 0 for ambiguity. The developmental assessment of young children, second edition DAISY 2, a standardized tool that was accessible at my research context with a good psychometric property, was used to evaluate the abilities of the young children in 5 developmental domains. And the Indian scale for the assessment of autism, Isha scale, was the only available standardized scale for the Indian context, was used to assess the severity among the autistic kids. Procedure: participants are assessed with a modified Edinburgh handedness inventory to evaluate the emergence of hand preference, and each item was presented in the midline, and the active hand which was used to complete the task was recorded. The development of the child was evaluated using DAISY 2 through interview with parents, and each element was tested and scored independently. Isha score was used to assess the severity among the selected children, and they were categorized into mild, moderate and severe levels, and the scoring was based on the information given by the parents and observation of the child. And the scores on DAISY 2 were then correlated with the scores on the modified Edinburgh handedness inventory. The result of the study: a total of 54 children were recruited, out of which 43 were boys and 11 were girls, and the mean age of the children included was 52.09 months with a standard deviation of 9.089, and the Isha score revealed that 25 children belong to the mild category and 26 belong to the moderate category, and 3 of them belong to the severe category of autism. And the emergence of hand preference based on the Edinburgh handedness inventory was significantly associated with expressive language, receptive language, social emotional, adaptive behavior, fine motor domains of DAISY 2 with the weightage to age. And 42 children among 54 had a hand preference emergent for at least 8 out of 12 items on the inventory, and only a couple of children had a left hand preference for more than 5 items. And the emergence of hand preference is not significantly correlated with the gross motor development and the cognitive domain of DAISY 2. And the statistical significant correlation among the interdomain scores of DAISY 2 indicate that the development is intertwined and the development of one domain is dependent on the other. The number of ambidextrous items is negatively correlated with the age, which clearly indicates that the emergence of hand preference increases as the age increases, and the number of ambidextrous items is negatively correlated with all other domains of DAISY 2 except for the gross motor domain. And Isha scores were negatively correlated with the DAISY scores and the emergence of hand preference. Discussion: the emergence of hand preference was significantly correlated with the developmental domains, and few studies also examined this relationship, that the children with stable directional hand preference exhibited more object storage acts, object contrast and performance ability. So thus these skills in turn promote further development of other motor skills, adaptive behavior and or cognitive ability. And significant association between the emergence of hand preference with the fine motor and social emotional domains was revealed in the study, which is also mentioned in the prior studies that show the fine motor skills improve higher social skills of the developing child. Since the development of hand preference is a foundation for the development of fine motor skills, hand preference indirectly support the development of social maturity, more efficient self-help skills and even better academic performance. And significant association of hand preference and language, both receptive and expressive, indicate that the children with inconsistent hand preference during their early stage of development showed a higher language skill. And this study also reveals that the scores of cognitive domains are strongly correlated with all other developmental domains except for the motor skill, which shows that the development of cognitive domain facilitate the development of language, social, emotional and adaptive behavior. So this is also mentioned in the prior studies that says that the cognitive development development in infants helps to regulate speech which is heard, and it enhances the construction of language, and impaired cognitive function impedes the development of adaptive behavior, social emotional skills attained according to the age. The conclusion of the study is handedness is associated with the child's global development, and it is important to assess the defects in this aspect to guide more targeted intervention for the children with ASD to improve their quality of life, functional ability, and the performance of activities of daily living. And these are the preliminary results. We are continuing with the data collections to include more ASD children with a left hand preference to analyze the clear significant association of the hand preference and the child development. So these are my references. Thank you.
Just one announcement, all the student posters, students who have put up their posters outside, please meet us outside because you'll have your presentations in a couple of minutes.
Thank you, Dr. Harini D, for completing your presentation well before time. Now I call upon Dr. Raghuram P from Chennai to present his paper on effectiveness of occupational therapy intervention in improving handwriting skills among primary school students in South Chennai. Your time starts.
Good morning all. My study is about effectiveness of occupational therapy intervention in improving handwriting skills among primary school students in South Chennai. Coming to the introduction, writing is a tool for communication. It offers a way to express ideas, emotions and thoughts. Handwriting is more than just a motor skill. Also, the study shows 24 to 58% of educational tasks include handwriting, making it a crucial skill. 34% of students in India struggle with their handwriting. Illegible handwriting is a sign of handwriting problem. It will impact a student's ability to learn during the school day. So these are all my review of literature. Coming to the aim of the study, to find out the effectiveness of occupational therapy intervention in improving handwriting skills among primary school students in South Chennai. Coming to the objectives, to evaluate the effectiveness of occupational therapy intervention among primary school students, and to interpret the effect of occupational therapy interventions with respect to grades, that is 1st standard to 5th standard. So the null hypothesis and alternative hypothesis. Coming to the methodology, my study design is experimental study design. Studies setting and subject recruitment were recruited from schools of South Chennai using purposive sampling based on the selection criteria. After the screening process, a verbal explanation of the study protocol was explained. An assent form was obtained from the parent for authorizing their participation in the study. So I have shown the flow chart. This way the study was conducted. So approval from the Institutional Ethics Committee. Study period was 4 weeks. The screened 12 students, grade 1, that is standard 1, 3 students, standard 2, 3 students, standard 3, 2 students, standard 4, 2 students, standard 5, 2 students. So based on the selection criteria, 5 members included, 7 members excluded. Then study sample, that is the study sample is 5, purposive sampling from each standard, that is from standard 1 to 5th standard, 1 student included. Then occupational therapy intervention was carried out for 12 sessions. Then post-test was conducted, data analysis and results. So coming to the selection criteria, my inclusion criteria is participants between 6 and 11 years of age, included both boys and girls, that is from each grade, 1st standard to 5th standard. Children with a score of less than 90% in total letter legibility and below 85% in total word legibility based on the standardized tool on evaluation tool of children's handwriting. Exclusion criteria is children with any neurological, developmental, congenital, psychiatric and orthopedics conditions are excluded. So these are my sessions outlined. So I have planned for warm-up session, then activity sessions and wind-down sessions. In the warm-up session, brain gym activities like cough pump, then crawl activities, and the gross motors activities like catch and throw ball, animal walking, and coming to the for 30 minutes activities, clay activities, find the word from the given paragraph, frame the sentence, stringing of beats activity, then homework checkup. These activities were graded from first standard to fifth standard according to the level of severity, and it was tailor-made sessions for each individuals from first standard to fifth standard. Then the worksheet was given for 5 to 10 minutes, and the wind-down sessions with the feedback, then home program and reward. So these are the photographs of my study. So coming to the data analysis and results, the pre-test for the first standard to fifth standard using ETCH is 75, 77, 77, 85 and 53 respectively, and the post-test score was first standard to fifth standard is 93, 80, 92, 96 and 73 respectively for the word legibility. So it shows that the individual from fifth grade have shown the maximum amount of improvement with the contribution, which contributed to the 27.39% from the pre-test, and the least improvement was shown by the second grade individual, which contributed to 3.75 with compared to the pre-test. So coming to the letter legibility, the pre-test score was 80, 76, 90, 84 and 85 for the first standard to fifth standard students, and for the post-test was for the first standard to fifth standard is 94, 90, 96, 95 and 88 respectively. In this analysis, second grade displayed most improvement, which contributed to 15.55%, followed by grade 1, which contributed to 14.89%. So coming to the discussion, so I have highlighted the CALP 2013 study, the significance of tailoring the approaches and strategies to the participants. It increases the likelihood of effective outcomes with approaches and strategies tailored to the participants. So the grade 1 analysis, students contributed to an increase in letter legibility, which is 14.59%. This analysis supported by the study by Kadan in 2016. The grade 2 analysis contributed to an increase in letter legibility and word legibility, which is 15.50% and 3.75%. This study is supported by the study done by Kolster and Stephenson in 2002. And in grade 3, the students contributed to an increase in word legibility and letter legibility, which is 16.30% and 6.7%. This study is supported by the study done by Kolster and Stephenson in 2002. The study, the grade 4, the analysis for the grade 4 students contributed to an equal increase in word and letter legibility, which is 11.45%, 11.57%. It was supported by the study done by Mary France Morin, that is published in 2012. In grade 5, analysis contributed to the increase in word legibility, which is 27.39%. These participants showed maximum improvement in word legibility because the student is already well versed in terms of writing letter. So these participants have shown increased score in word legibility than letter legibility, supported by the study done by K. Smith in 2002. This study supposed that there was improvement due to effective occupational therapy protocol in improving handwriting skills among primary school students. This result was obtained with 4 weeks of occupational therapy tailor-made individualized interventions. So coming to the limitations and recommendations, the study was done in a specific institution thereby may not reflect the entire population, and it's a short duration of intervention. My recommendations are, studies can be longitudinal studies over a longer period comparing different approaches to remedial handwriting difficulty in a stratum population. Further studies can be done as a randomized control trial. Besides handwriting skill, further studies can be done considering measures like reading, ability, academic success, motivation and the child's self-esteem. So coming to the conclusion, the present study aimed to find out the effectiveness of occupational therapy intervention in improving handwriting skills among primary school students from South Chennai. The results of the study concluded that the participants had significant improvement due to 4 weeks. Effective occupational therapy, tailor-made individualized intervention protocol based on their grades, first standard to fifth standard, in improving handwriting skills from South Chennai. The study emphasized the need for more occupational therapy interventions among primary school students in improving handwriting skills. So these are my references. So I have used the ETC sketch scale. This is my master chart. Thank you.
Thank you, Dr. Raghuram. Your presentation, you finished well in time.
Okay,
Thank you.
Thank
the
you.
questions will be taken at the end of the session for all the presenters.
Okay, thank you.
Thank you. So our next presenter is Deepak Vignesh Raj S. from Chennai. His topic is the impact of sensory processing on sleep in children with autism spectrum disorder, a systematic review.
A very pleasant morning to one and all gathered here. The research study is titled as The Impact of Sensory Processing on Sleep in Children with Autism Spectrum Disorder, a systematic review. So what is the definition of sleep? So according to American Academy of Sleep, sleep is a regular and reversible state of consciousness characterized by diminished responsiveness to external stimuli, accompanied by changes in brain wave patterns and temporary elimination of voluntary movements and sensory awareness. So, sleep plays a crucial role in the physical and mental well-being and the overall health. Also, sleep plays a crucial role for adequate neuronal functions and the CNS maturations. Many children with neurodevelopmental disorder experience sleep difficulties, particularly children with autism spectrum disorder. But research indicates that approximately 50 to 80% of children with autism experience some form of sleep difficulties. So sleep disturbance in autism can lead to increase in challenging behavior, and also it increases the core symptoms of autism such as communication difficulties, restricted interest and repetitive behaviors. Therefore, the consequences of sleep deprivations in autism interfere with occupations and participation in activities of daily living. The cause of sleep disorder in autism is multifactorial, but sensory processing concerns play a vital role, and research also suggests that difficulty in the ability to filter out environmental sensation could interfere with sleep. So in 2011, Reynolds et al. Found that there is a significant relationship between sensory processing and sleep, and suggested that atypical sensory processing should be considered in the sleep intervention. Therefore, there is a need for conducting systematic review for understanding the interrelatedness between sensory processing and sleep, which might shed light on the development of more focused, effective and tailored intervention. So therefore, the aim of the study is to systematically review and evaluate existing literatures in order to investigate the relationship between sensory processing and sleep in children with autism spectrum disorder aged 3 to 12 years. As a first step, we registered this systematic review protocol in Prospero, and we followed PRISMA guidelines for reporting, and we used electronic searches as Scopus, PubMed, Embase and OTSeeker. And these are all some of the key terms which we used for search strategies in the domain of sensory processing, sleep and autism spectrum disorder. And based on the selection criteria, we have included studies in the systematic review. The studies which have focused on the relationship between sensory processing and sleep in children with autism spectrum disorder aged 3 to 12 years has been included in the study, and the studies which has been published between January 2012 to December 2022 has been included in the systematic review, and the studies which are available in full text and English has been included in the systematic review. So the case series, case reports and expert opinion, systematic review and meta-analysis has been excluded from the systematic review. And to evaluate the methodological quality of included articles, we have used McMaster critical review form for quantitative studies, which consist of 16 different items that assess various aspects of methodological quality of the studies as mentioned below, and each item is assigned a score of 1 if it meets the specified criteria and a score of 0 if it does not. After a comprehensive article search, we found around 2,612 articles from the electronic database and search of articles. And after the title, abstract and full text review, we have included 9 articles in the systematic review. So this is my critical review for all the studies. Among the 9 studies, 7 has obtained very good methodological quality and 2 has obtained good methodological quality based on the scores of McMaster critical review form. So the first study has found that there was a significant correlation between sleep and the sensory quadrants of sensory profile 2, and the second study has found that there is a relationship between tactile under responsivity and sleep qualities in ASD, and the third study has found that there was a significant positive correlation between the activities per minute during sleep and low threshold to vestibular and oral sensory stimuli. And the fourth study has found that the relationship between sensory processing and sleep problems was evident in children with autism spectrum disorder in both hypo and hypersensitivity profile. And the fifth study has found that there was a significant association between sleep disruption and increased sensory seeking, sensory sensitivity, and atypical touch and movement processing. The sixth and seventh study has found that there was a strong correlation between the sensory over responsivity and sleep. The seventh study has found that there is a significant correlation between the atypical tactile and oral processing and sleep disruption in children with autism spectrum disorder. So the ninth study has found that there was a significant association between atypical oral processing and sleep anxiety. Also, children with sensory seeking behavior and auditory filter difficulties encountered sleep difficulties. So the research highlights 3 distinct processing patterns, with each contributing to sleep related challenges in unique ways. Children with under responsivity may miss the environmental cues that regulate the sleep wake cycle, thus causing sleep disturbances. Children with sensory seeking are hyperactive, restless, and too busy in sensory seeking experiences, impacting their ability to transition into sleep. So children with sensory over responsivity may be sensitive to sensory related aspects of sleep environment, such as background noise, room temperature, and sleepwares, which may interfere with onset or maintenance of sleep. Research have also suggested that children with tactile processing abnormalities to be associated with altered levels of GABA neurotransmitters, which plays a crucial role in sleep regulation, and these changes can imply difficulties in initiation and maintenance of sleep in children with autism spectrum disorder. And the children who are sensitive to certain taste may become anxious with everyday activities such as brushing prior to bed, causing sleep onset delays. So since sleep plays a crucial role in the adequate neuronal function and the maintenance of and the facilitation of CNS maturation, all occupational therapists has to start giving importance for sleep intervention and create magic in the field of occupational therapy. And this systematic review will improve the assessment protocol for children with sleep difficulties and aid in the development of tailored intervention to make sleep problems in children with autism spectrum disorder. And the limitation of the study is we have included only 4 databases, and we have included only studies which are published in English. And the systematic review conclude that the impact of sensory processing difficulties in sleep is evident in children with autism spectrum disorder. However, the type of sensory processing difficulties or the sensory system affected is diverse and inconsistent. And the relationship is multidimensional and context driven. More research is needed to quantitatively and qualitatively analyze this relationship. And these are all my references, and thank you.
Thank you, Dr. Deepak Vignesh, for completing your presentation before time.
Yes, ma'am.
Question answers will be at the end of the session.
Yes, ma'am.
So now I would like to call upon Dr. Abhiram Yu, who would present on relationship between duration of immobilization, hand injury severity, and shoulder functional outcome in clients with a hand injury.
So, very good morning. I can start now? Yes. So, the title of my study is Relationship between Duration of Immobilization, Hand Injury Severity and Shoulder Functional Outcome in Clients with a Hand Injury. So, these are my contents that I will be discussing. Introduction. Hand injuries are among the most frequent injuries worldwide that constitute between 6.65 to 28% of the injuries. And almost 28% of the musculoskeletal system injuries constitute hand injuries. The severity, form and features of the structure that undergo injury can impact the long-term results and the return to work. For a successful functional task to be performed, there is a need for coordination between the wrist, elbow and shoulder joints where they work as a functional chain. So after a hand injury and after the consequent immobilization, there are generally secondary changes that happen, such as the muscle atrophy, stiffness and movement restrictions. Most reported of these are secondary changes to the proximal areas to the injury. And from the previous studies, we get to know that patients with hand injury develop pain in the shoulder, and interventions that included the shoulder had an increased functional outcome compared to isolated interventions. Coming to the rationale of my study, shoulder problems developed secondary to a hand injury was a major concern, where most of the studies reported pain in the shoulder, and they also reported the need for shoulder rehabilitation. The studies available focused more on client factors such as pain and the loss of range of motion, but they did not take into consideration shoulder function as a whole. And there was limited literature that was found on the influence of immobilization period and the injury severity on the shoulder's function. And since shoulder being the major contributor of movements to the hand, it becomes imperative for us to understand the impact a hand injury would have on the shoulder. So the aim of my study is to study the relationship between duration of immobilization and severity of hand injury on the shoulder function. The methodology, my study design was a cross-sectional observational study. Participants were individuals with hand injury below the level of elbow. The sampling method I had used was purposive sampling. Sample size was 82. I had used two instruments, that is modified hand injury severity score and constant Murley scale. Statistical analysis was done using the SPSS IBM version 28.0. The descriptive statistics were used along with tests of correlation of Pearson and Spearman, and also independent t-test and man-Whitney test to compare the means. My sampling criteria, the inclusion criteria included participants from the age of 18 to 60, participants with hand injury below the level of elbow, and participants were included only after a day of removal of the cast immobilization, and participants who understood English and Kannada. Exclusion criteria were participants who had direct injury to the shoulder on the testing side, participants with a history of shoulder impairment on the testing side, and participants with any other comorbidities and upper limb injuries prior to the current injury, and also with participants who were having contraindications to movements. The procedure that I had followed, where I had received approval from the Departmental Research Committee, the IRC, followed by the Institutional Ethical Committee. Participants were identified, the procedure was explained to them, and their informed consent was obtained. Further, the participants were screened and included or excluded based on my criteria. Further, the data was collected of the participants' demographic details, the two scales that I had administered, and certain diagnostic information. Coming to the results of my study, these are certain descriptive features where male participants were close to 82%, and hand dominance where 92% of the participants were right hand dominant. And coming to occupations, 54% of my population were manual workers. Injury related factors, injury group, it was osseous soft tissue injuries were close to 47 and 42%, and 57% were injuries to the right hand, and level of immobilization, almost 81% of the participants were below elbow injuries and 18% above elbow injuries. A descriptive summary of my variables: period of immobilization, mean and ST 24.57, and MHIS and Constant-Murray mean and medians I have mentioned. So coming to my main findings, the correlation. So correlation between period of immobilization and shoulder function, there was a negative correlation, and also hand injury severity and shoulder function, we found a negative correlation, which shows that more the period of immobilization, the shoulder function deteriorated further. Similarly, again, the higher the hand injury severity, there was a deterioration more in shoulder function. These are my scatter plots, and I had done a comparison of meals between the level of immobilization, and it was found that above elbow injuries had a better prognosis in terms of, above elbow had a poorer prognosis in terms of the shoulder function compared to below elbow injuries. Again, in the injury severity, there was something that we found where the manual workers, they had a higher injury severity in hand injury. That was one of my findings. Coming to the discussion, there was a negative correlation between my shoulder function and the period of immobilization, which was consistent with the results from previous studies, and also a negative correlation between the injury severity and the shoulder function. There was also, there's no clear evidence, but it's also supported by study by Saxena et al. And there was also a significant difference in the means of CMS score between above elbow and below elbow, which shows a very significant conclusion. Coming to my conclusion, the result concluded that longer the duration of immobilization or higher the injury severity, higher is the restriction in the shoulder function. And another interesting finding was that the participants with above elbow immobilization had higher shoulder impairment than the participants with below elbow mobilization. And this study emphasizes the need to be aware of the possible shoulder problems that can occur after a hand injury, so that clients can be targeted at the acute phase only, so that we can prevent these secondary complications that happen. It can help the clinicians to identify, prevent, and manage such secondary complications and plan the treatment protocols accordingly. These are my references. Thank you.
Thank you, Dr. Abhiram. For also appreciate that you have finished your presentation in time. The questions will be taken later. Here I invite Bhavita Sharma. Her topic is WhatsApp dependency, patterns of use and fear of missing out in housewives, a cross-sectional study. You can start your presentation now.
Good morning, everyone. Today I, Bhavita, am here to present my study whose title is WhatsApp Dependency, Pattern of Use and Fear of Missing Out in Housewives, a Cross-Sectional Study. These are the contents. Well, notification revolution. Beyond ringtones and SMS, social media and messaging apps bombard us with custom sounds, demanding our attention every time. And there's an app, WhatsApp, which extends with 2 billion plus users globally and 487 billion users in India itself, transforming from mere a messaging app into a communication platform across demographics. Constant notification triggers a sense of urgency and frequent device checks driven by FOMO, that is also called fear of missing out, and fueling engagement every time. Rationale, well, beyond optional. Now there's a study which says that platforms like WhatsApp transit from optional tools to becoming an integral part of our lives and bridging social gaps and fulfilling needs for connection. Well, it also brings an important notice to all the OTs that it is crucial to understand how this impacts clients' daily activities, roles and routines. Bridging the research gap in Indian housewives, this study explores WhatsApp dependency, usage pattern and FOMO experiences among Indian housewives. This research aims to fill a research gap and enrich our understanding of their digital lives. Now the aim and objectives. Aim is to understand the WhatsApp dependency, pattern of use and fear of missing out behavior in housewife. And objectives was to assess the dependency, fear of missing out, and analyze the pattern of WhatsApp usage. Methodology. It was a cross-sectional survey. 100 samples were chosen by simple random process from the community. And the parameters were participants' dependency, pattern of use, and fear of missing out. Target population was from 20 years to 50 years, and participants specifically owning a WhatsApp account were included in this study. Exclusion criteria was that participants who cannot read and understand English were excluded, and withdrawal criteria that voluntary withdrawal was allowed from the study even after the consent. Now, the outcome measures which were used were WhatsApp dependence scale, WhatsApp use pattern questionnaire, and fear of missing out scale. Well, WhatsApp dependence scale had it's a 16-item questionnaire which measures mild, moderate, and severe dependency from never, rarely, frequently, and always. And WhatsApp use pattern questionnaire is a 14-item questionnaire which assesses the multifaceted aspects of WhatsApp usage pattern. Then FOMO scale, it's a 10-item unidimensional scale which is set on a 5-point Likert responses, and item scores average from 1 to 5. Higher score means higher FOMO. After the ethical approval was taken, participants' consent form was taken in written form, and then filling of questionnaires was processed. Now discussing about the results and discussion, all variables were analyzed using SPSS 22 version, and this study used descriptive analysis, Spearman correlation analysis to analyze the research variables. As you can see the sample characteristics that 41% of housewives were graduated, and 30% came into 9 to 12 standard, 23% came into post-graduation level, and up to 8 standard 5%, and not known was 1%. Now the sample characteristic 2, it's about the monthly family income. 23% came under the 30,000 to 46,000 criteria of monthly family income. And this study included participants as 20 years to 50 years, so the mean age was 36.33 plus minus 7.58 years. Now as you can see in the given pie chart, that WhatsApp emerged as a predominant social media application followed by other social media application. As a result, a similar trend was also noticed in another study where WhatsApp came out to be the most liked app and used social media application by housemakers. There was one more study, but it was not on housewives, Semper et al. There also WhatsApp came out to be the most popular app. Now coming upon the findings of WhatsApp dependence scale, it was seen that out of 100 housewives, 63% of housewives have had mild dependency, whereas 15% of housewives exhibited moderate level of reliance on WhatsApp, and 2% in severe, and 20% no dependency. Now coming, why do you use WhatsApp? Well, the first reason came out to be ease of communication, then user-friendly approach, and speed information and transfer. The same trend was also observed in other study where respondents also listed that it is very easy to understand, user-friendly, and best message service to go with. There is a study by Rishi et al. It was seen that homemakers dedicate an average of 2 to 3 hours daily on WhatsApp. In our study, it was seen that 40% of housewives reported a reduction in time spent on other social media platform after joining WhatsApp, whereas taking them to 17% checked WhatsApp every time they heard an incoming message tone, and 6% of housewives checked it more than 6 times while at work. And then doing that, 24% of housewives reported that they end up spending 3 to 5 hours daily on WhatsApp. Now the most used features of WhatsApp came out to be first text messages, then followed by photos, videos, forward information, and then voice messages in that order. Now moving on, that 39% of housewives prefer sharing jokes or humor on WhatsApp, while none used it for advertising or promotional information. And forwarding received messages was prevalent was not prevalent among this sample, acknowledged by 27% of participants. And you will be see that more than one third of the sample, 36% of housewives expressed willingness to continue using WhatsApp even if it becomes into a paid application. Now, the results of FOMO scale indicate that FOMO scale has 5 measures to make. First is not at all true of me, second slightly true of me, third moderately true of me, then very true of me and extremely true of me. As you can see that slightly true of me has 49% and moderately true of me has 29%. So 49% of housewives believe that they experience FOMO. And in under moderate category, 29% comes, and very true, 11% housewives comes under the 11% category, and 1% extremely true of me category. Coming on to the additional findings, this table shows the correlation of between FOMO and WOTS having 0.50 correlation, and similar finding was also seen in a study where positive correlation between social network use disorders came. Now, limitation had a small sample size and done in a single location, so we cannot generalize the findings, but yeah, more correlation and occupational therapy interventions are recommended for future with larger sample size, multicentric sampling suggested for future. Now, coming on the conclusion, housewives with higher dependency and FOMO were given an occupational therapy education booklet which promoted digital literacy, self-esteem, positive habits, and yeah, it gives a good way to occupational therapists to understand and promoting digital well-being concept. These are the references. Thank you.
Thank you, Dr. Bhavita, for completing your presentation on time. Question answers at the end. I would like to call upon Dr. Aradhana Naik from Thrissur, and she would be presenting on prevalence of musculoskeletal disorders and healthcare utilization among female homemakers in rural Odisha.
Good morning, everyone. I welcome you all to my presentation. The title of my research is Prevalence of Musculoskeletal Disorders and Healthcare Utilization Among Female Homemakers in Rural Odisha. This is the content of my presentation. Coming to introduction. Musculoskeletal disorders are the most common occupational health problem with global disease burden of 17% years of life lived with disability. It is a gradually progressive degenerative condition which can severely limit function and impact quality of life. Work-related prevalence of musculoskeletal disorders in India is around 90%, and women suffer more from MSTs due to various physiological, psychological and social factors. Large number of Indian women do unpaid domestic work, and they are commonly known as homemakers or housewives. Study in rural Uttar Pradesh showed the prevalence of MSTs among housewives was 40.9%. And in spite of having such high prevalence, the awareness regarding MSTs is poor among women. Coming to rationale, previous studies conducted in Odisha among women engaged in papad and agarbatti making have shown prevalence of MST to be high, approximately around 90%, and low healthcare utilization, that is 46.7%. A research gap was found in case of female homemakers. So in this study, an attempt has been made to substantiate the findings among female homemakers in rural Odisha. The objectives are to find the prevalence of MST among female homemakers in rural Odisha, to assess the pattern of healthcare utilization, to determine the association of MST and socio-demographic variables, and to determine the association between healthcare utilization and socio-demographic variables. Coming to methodology, time period of the study was from December 2022 to May 2023, setting villages of Bhadrak, Odisha. Design was cross-sectional quantitative study design. And the population was female homemakers. Sample size 373. Sampling technique, purposive sampling. The sampling criteria was inclusion, women in the age group of 18 to 50 years, exclusively engaged in domestic work. And exclusion criteria, MST due to any other disease or injury, any visible physical deformity, any known mental health condition, pregnancy and having household. Study tools, a standardized Nordic questionnaire and a self-reported questionnaire for healthcare utilization which was prepared in Odia. Study procedure, first the ethical approval was obtained from the Institutional Ethical Committee. Written informed consent was obtained from each participant after providing due information, and all ethical guidelines were followed during the entire procedure of the research. Initially, permission was obtained from the village sarpanch, and accredited social health activists were contacted, and the list of participants was prepared using the study criteria. Data collection was done visiting house to house. Coming to data analysis, Google Forms, Microsoft Excel, SPSS version 29 has been used. Descriptive statistics was done using frequency percentage, measures of central tendency, and association of various variables was established through chi-square test with level of significance set at 0.05. Coming to results, descriptive statistics. Table 2 is showing demographic characteristics, and most of the participants were in the age group of 40 to 50 years, married, educated till secondary level, were having an family annual income of less than 1 lakh and were living in small families. Coming to musculoskeletal disorder status, figure 1 is showing the prevalence of MST which was found by the study, that was 59.79%. And figure 2 is showing the detailed joint-wise involvement among the participants. And it was found to be most of the participants were complaining of problem in the lower half of the body. This might be because of their usual working posture for washing, cooking and cleaning house, which is squatting position. Coming to healthcare utilization, figure 3 is showing the healthcare preference among the participants with MST, and it was found 47.54% used professional healthcare, 36.32% used non-professional care, and 16.14% just ignored their condition. And table 3 is showing detailed description of activities opted by the participants with MST who use non-professional care. Around 69.14% used medication without prescription, and other options were hot pack and massage. Table 5 is showing the detailed description of professional healthcare services utilized by the participants with MST. 62.3% went to private facilities, and 80.19% consulted an allopathy doctor. And astonishingly, only 0.9% went to one physiotherapist. X-ray was the highly used diagnostic procedure, and in recommended treatment, 85.85% was recommended to take medication, and only 6.61% did exercise along with medication. Table 6 is showing distribution of healthcare preference of participants with MST as per different variables. Professional healthcare was sought by 40 to 50 years age group living in small families, and 18 to 28 years participant with higher education living in large families ignored their condition. Coming to inferential statistics, association of MST was found with age with a chi-square score of 60.047, p-value less than 0.001. In healthcare utilization, no statistically significant association was found between healthcare utilization and other different variables. Coming to discussion, this study reported 59.79% prevalence of MST. In another study conducted in Delhi and Noida, the prevalence was found to be 60%, and a study from Raipur, Chhattisgarh showed 61% prevalence of MST among housewives. 47.54% used professional healthcare, 80.19% of them consulted an allopathy practitioner, and this is supported by state-wise data of rural Odisha from NSS 71st round showed 90.9% of females prefer allopathy care. 36.32% participants utilized non-professional care. 69.14% of them used medication without prescription. This is supported by the previous study which stated that 70% of people in Odisha buy medicine from chemists without prescription. Coming to the conclusion, prevalence of MST among rural female homemakers of Odisha was high, but professional healthcare utilization was low. Moreover, the awareness and use of rehabilitation services was marginal among the participants. And these findings can be used for developing preventive programs and health education plans for women and their family to create better understanding about the physiology of MSTs, proper working postures, and timely healthcare utilization to minimize the impact of MST, functional limitation, dependence, and disability. These are the references. Thank you.
Thank you, Dr. Aradhana, for your in-time presentation. Thank you. Now I call upon the next speaker, Vaishnavi Joshi. Her topic of presentation is prevalence of myofascial trigger points and related disability in patients with migraine, a cross-sectional study. You can start now.
Ma'am. Good morning to everyone. My name is Vaishnavi Joshi. Today I am going to present a study on the prevalence of myofascial trigger points and the related disability in patients with migraine, which is a cross-sectional study. So we'll be covering introduction, rationale of the study, aims and objectives, methodology, results, and conclusion of the research. So first of all, what exactly is migraine? So migraine is a disorder with episodic manifestation that is defined by throbbing pain of moderate to severe severity, as well as additional symptoms like nausea, vomiting, photophobia, and phonophobia. In India, the prevalence of migraine is 15.4%, and WHO says that it is third most common cause of disability in terms of years spent disabled. Broadly, there are two types of migraine, that is episodic and chronic. Episodic means that the patient suffers with more than 15 days of headache per month, and of those 15 days, around 8 of the days has to be the migraine days. And in chronic migraine, it is like the patient is suffering from less than or equal to 14 headache days per month. So there are many aspects where migraine affects a patient. So a few I would like to highlight here. First of it being that the healthcare visits. So it is reported in a study that more than 60% of the healthcare visits to a tertiary care headache centers are due to migraine. So which of course leads to more medical costs, occupational absenteeism, and it is reported that majority of the patients fall in the productive age group, which eventually leads to financial burden. And it is reported that these patients tend to use the medications excessively, maybe with or without consultation from the doctors. So the disability, missed work, the different musculoskeletal impairments, and limited families and social activities further leads to deterioration of the quality of life of the person. So because of all these things, more than 80% of the migraine patients experience the functional impairment, which lead to migraine-related disability. A few fun facts I would like to quote here is that several investigations have found a link between migraine and musculoskeletal impairments. The myofascial trigger points are one of these deficits that has gotten a lot of attention in the headache literature. When stimulated, the myofascial trigger points are the hypertensive sites within the tense bands of the skeletal muscles that cause the referred pain, autonomic and motor symptoms. Also, when induced referred pain reproduces the patient's symptoms, the myofascial trigger points are deemed to be clinically active. The rationale of the study: the referred pain induced by the myofascial trigger point can mimic the migraine pain features. Some investigations have also shown that the migraine appears to be relatively active. In migraine, it appears to be relatively active. By stimulating the trigeminocervical nucleus caudalis, the myofascial trigger points have also been potential as triggering or increasing the migraine attacks. Despite the fact that several foreign studies have shown the predominance of the myofascial trigger points in migraine, there is a paucity of Indian data on the subject. Also, the association between the myofascial trigger points and the migraine-related impairments are yet to be explored. Thus, it is critical to understand the incidence of the myofascial trigger points in the Indian environment, as well as to examine the muscles of head, neck and shoulder area for the myofascial trigger points diagnosis and to determine whether they are linked to the migraine-related disability. The aim of the study was to determine the prevalence of the myofascial trigger points and assess their correlation with the occupational disability in patients with migraine. The primary objective was to examine the prevalence of the myofascial trigger point and occupational disability in this population. The secondary objective was to explore the potential associations between the myofascial trigger points and the occupational disability. Methodology: it was a cross-sectional study with a sample size of 384. It was done in a neurology department of a tertiary care super specialty hospital. The inclusion in the study population included the migraine patients of age group of 18 to 60 years, diagnosed and referred by the physicians and or the neurologists. The exclusions were the headache apart from the migraine types. So first of all, the informed consent was taken from the patient, followed by the assessment of the myofascial trigger points, wherein the diagnosis criteria of the myofascial trigger point was the presence of a palpable taut band in the muscle, the presence of a tender spot in that taut band, local twitch response on palpation of the taut band, and reproduction of the referred pain in response to compression of the spot. Also along with that, the MEDAS scale, that is Migraine Disability Assessment Scale, was used, which had 5 questions related to days of partial or total loss within last 3 months, which is regarding the paid work or school, household chores, family, social and leisure activities. So these were the muscle groups which were palpated for the myofascial trigger points: the suboccipital, temporalis, posterior cervical, upper trapezius and occipitofrontalis. The data analysis and result. The data was summarized using a descriptive statistics in a form of a table for the background characteristics of the study participants. The prevalence was determined and its lower and upper confidence level was calculated at 95%. Number and percentage of the participants having migraine with myofascial trigger points was summarized in a tabular form, and the scores of MEDAS were summarized using the mean and standard deviation. The Pearson's correlation between MEDAS and the number of trigger points and the migraine frequency and intensity was calculated, and the p-value less than 0.05 was considered statistically significant. So the first table here describes the background characteristics of the study participants, wherein important to note was that the majority patients were females. That is 84.9% of the study participants were female, and the mean age recorded was 37.2 years with a standard deviation of 11.7. The next table shows the number of active myofascial trigger points and the percentage of the study participants. So the majority study participants, that is 74.5%, had more than or equal to 4 myofascial trigger points. And it was reported that 91.93% were having 1 or more active myofascial trigger points. The graph shows the distribution like proportion of the myofascial trigger points along at the site of the muscles. So it was noted that the maximum was found in The maximum was found in temporalis and the occipital muscle groups, and majority patient reported bilateral occurrence while the MTRPs were checked. And the age, gender, and the employment status did not show any significant influence on these MTRPs. And while the result was calculated in the Pearson's correlation, it was noted that MEDAS score demonstrated a moderate positive correlation with the duration of the migraine experience. And in other words, it can also be said as the increase in the duration of the migraine was associated with higher level of migraine-related disability. In conclusion, high prevalence of active MTRPs in head and neck muscles among the individuals with migraine, particularly in the temporalis and suboccipital muscle groups. Moderate positive correlation between the duration of the migraine and migraine-related disability as measured by MEDAS. And these results emphasize the need for a nuanced understanding of temporal dynamics of the myofascial trigger points and their role in contributing to the migraine-related disability, offering directions for targeted interventions in the management of migraine in Indian population. Thank you.
Thank you, Dr. Vaishnavi. Now I call upon all the speakers in this session, presenters, for question and answer session.
All the 7 speakers finished their presentation before 10 minutes. So that was a good thing.
Please note, only 2 questions will be taken for each presenter. Now, first presenter, Harini D. Any question? Dr. Ashwini.
Myself, Shanta from Delhi. I want to know the mean age of your participants and whether it was a reference with the normal brain lateralization age. Normal age for brain lateralization.
So the mean age of my study is 58 months. So as the DAISY scores was in month, we were calculated it in month, and the stable directional preference takes place at 3 years. So it was all. I hope did I answer your question?
Okay. Second question.
Good morning. My name is Dr. Ashwini and I'm from Mumbai. You mentioned that there was an increased prevalence of left-handedness among the ASD population. What is the prevalence of left-handedness in the general population, would you know?
So it varies according to the cultural difference also. In the Indian population, the majority of the people are right-handed according to the previous studies, and the left-handedness in the Indian population is less. So the percentile has been mentioned in the full article. So this study, the ASD also has a prevalence of left-handedness but it is for the Indian population, so I got very less left-handedness.
Okay.
Okay.
Thank you. Next speaker, Dr. Raghuram.
Hello. Myself, Dr. Kamalaya from New Delhi. I have a question that given a small sample size, how do you justify regarding that you're representing a South Chennai and as well as you did a data analysis, stats analysis with a small sample.
No, sir, being it is a pilot study, I just want to make a awareness about the importance of occupational therapy in mainstream schools. So I thought that through lottery method, we have selected few schools, and also we have selected a sample for each grade. So the aim of the study to make the awareness to the school sectors that occupational therapy intervention is very important to improve the handwriting skills. So that's why I have selected a very less number of samples, sir.
Okay, thank you.
Second question, Dr. Soumi.
Thank you, ma'am, for letting me ask a question. Dr. Raghuram, good afternoon for your very good presentation. Just one small question. First standard to fifth standard is a very big age range. So did you also consider the academic challenges which go on as per the age while taking the age group into consideration or your target population?
No, sir. Actually, the standardized scale itself clearly defined. Okay, the age between 6 to 11 years, and for the first standard, we have clearly defined what kind of activities can be given. That is through tailor-made. So we thought that if we select one student from a grade, that is first standard grade, second standard, third standard, so it will help us to make the importance of occupational therapy intervention. Whoever having handwriting difficulty, and just to make the school sectors to aware about the effective intervention of occupational therapy. So that's our aim. And one more thing, the sample is method is purposive sampling method. Okay, so the total legibility, word legibility, and everything is what according to the score, that is below 90 and below 85. So I didn't find any difficult in them to participate in this study, sir.
So the question was not on intervention, it was just on the assessment aspect. Although I'll discuss it later. Thank you so much.
You can talk to
Okay,
him
okay.
later. Okay, our next presenter, Dr. Deepak. Any questions?
Hi, this is Ashwini again from Mumbai. Dr. Deepak, I was wondering about the clinical implications of your systematic review for sleep disturbances and sensory processing. What I would like you to reflect on, if possible, is what other factors other than sensory disturbances could contribute to sleep disturbances in your population that you choose?
Socio-economical status can influence a child's sleep, parenting, then schooling, and other academic activities can influence sleep disorder in autism.
And what does that mean for clinical implications for us as practitioners?
It will help in the tailor-made intervention. For example, it will help in the process of environmental changes or any other sensory-related based interventions.
Any other question?
Thank you.
Thank you. Thank you, Dr. Deepak. Our next presenter, Dr. Abhiram.
Before you ask questions to Dr. Abhiram, all the student IT presenters, please head to Abhi Hall downstairs where the GB meeting was or where the lunch was. Thank you.
Hi, I'm Dr. Amit Sethi from University of Pittsburgh. So you presented that there was an immobilization, the longer the immobilization,
Yes, sir.
the higher the disability outcome.
Shoulder dysfunction.
Yes, shoulder dysfunction. So what is novel about that? Don't we already know that the longer anybody has immobilization, the worse their outcomes would be? So what is the contribution of your study?
Yes, sir. So when, what intrigued me to get into this study was when we had clients coming up after a month of immobilization and they come back and we see that the shoulder has been ignored. and there has been some complications in the shoulder. That was the first reason that I got into this idea. Then when I went on to do some literature search, I had found out that there was not much focus on the shoulder as a functional component. So they focused specifically on, is there pain in the shoulder, is there range restriction in the shoulder, but the function of the shoulder was not taken specifically to identify. And there was no correlation studies that were done between hand injury severity and immobilization period with shoulder function. So why this is interesting is that hand injury severity score is something that we use, the surgeons use, all professionals will be using this. So this hand injury severity score is something that is scored in the initial phase, in the acute phase. So why this will help is that when we get a hand injury severity score, that can help us to predict or anticipate that there can be this shoulder function affectation can be there because of this amount of severity. So this correlation I wanted to establish and I wanted to find out. So that was why I had taken this up.
Thank you.
Thank you.
Any other?
Just follow on the same question about the shoulder immobilization.
Yes, sir.
Versus the hand injury.
Yes, sir.
As the first speaker mentioned that, so is nothing really new to say that the above elbow immobilization normally will have the more hand severity. What you have not done is to show anatomically that you have not actually measured the functional outcome using the shoulder with above elbow. You have not done anything about the functional outcomes using the below elbow. So therefore, it is inconclusive to say that the higher the immobilization of the shoulder, so there will be the less severity of the more severity of the hand injury. So therefore, anatomically, you have to really show that how you have used the shoulder in functional outcomes. So you have not actually used it to show that what is the severity in using shoulder in functional activities. So simply to say that higher the immobilization of the shoulder is the more severity of the hand injury. So that is not inconclusive. So therefore, what I would suggest is that you should take one step further to study and use the shoulder with the above elbow in functional activities, as well as using the shoulder immobilization using the below elbow. So you have to really compare between the above elbow and below elbow and the period of immobilization. But anatomically, because everything is variable. So you have to be very clear how you use the shoulder in functional activities. But the shoulder joint plays very important integral part using above shoulder activities. And you have not done any of those functional activities. So my advice will be to take this study further and use the shoulder more in functional activities to say that the higher the period of immobilization versus the period of hand injuries. So therefore, there are some inconclusive factors.
Sir, can I please add on to?
Thank you.
Can I
want to say something?
Yes, sir. Yes, sir. So the scale that I have used is a constant Murley scale, which is a shoulder functional questionnaire plus assessment. So it has subjective components and objective components where it assesses the function, sir. So there is components of pain, there is components of range of motion strength, plus there is components where it assesses how much you can reach the shoulder from the back, above, and everything, sir. So, and I have done a comparison of means between above elbow and below elbow, constant Murley score to determine the relation. So the score is basically, I took the constant Murley scale because I wanted to bring in the functional component, because all other scales were giving only client factors. So this particular scale has components of a function. So that is the reason I had used this particular scale.
Anyway, thank you.
I'll surely take into consideration. Thank you, sir.
You can further discuss
sure,
during lunch.
Thank you.
Thank you. Yeah, I call upon the next presenter, Dr. Bhavita.
Bhavika, what was the purpose of study on this WhatsApp used by the housewives?
Well, sir, these days, in fact, from last few years, our life has been surrounded by WhatsApp. Every important updates are coming on WhatsApp. So that was the first reason to opt for WhatsApp specifically. And housewives, because there are no so much of studies in Indian context on housewives, that's why I opted for housewives.
And what type of occupational therapy did you give them? Was it only for the neck strain?
No, sir. It is about the dependence, the way they are using it beyond the for their digital well-being. As the digital well-being concept is coming now very fastly to promote digital literacy. Many of us are not aware that how much hours we are spending on WhatsApp. I didn't go for the intervention study, but it was a cross-sectional. I provided them with a booklet having some measures they can take.
Okay.
Yes, sir.
Another question. Thank you, sir.
Thank you.
No.
Okay, sorry.
One more question.
Yes, ma'am. Sorry.
I just wanted to, you mentioned some fear of missing out, right?
Yes,
What does it missing out mean?
Well, fear of missing out is defined as that the person has a fear that others are having a more rewarding experience. It can be online and offline both. So the FOMO is of two types, basically trade FOMO and internet specific FOMO. So I discussed about internet specific FOMO. Yes, ma'am.
Okay. I call upon the next speaker, Aradhana.
Aradhana, your study definitely shows the problems faced by the Indian women because their position of work is very awkward. Because now if the person is in the upright position and using their back or hands, the problems will not be much. But while using in squatting position, most of them use in squatting position. That was rightly pointed out. I agree with you.
Thank you, sir.
I have some comments.
Yes, sir.
You have said that lower extremities there is a more problem, but my experience there is fingers of women are also affected and mental health of women. And my suggestion will be, can we approach the government of Odisha to give some financial aid to these women to change their position for working so that we can help them. The government is doing a lot of things for women at present. So we can make one project and submit it to the government so that we can change the working position of women. Thank you.
Thank you, sir. Thank you for your suggestion. Anybody else? We can take one question because, sir has given suggestion.
Aradhana, my question is more about your research than implications for occupational therapy practice. I noticed two findings that you reported. You reported that 80% of the people did consult an allopathic physician.
Yes, ma'am.
And yet there were 69% of the people who were resorting to medication without prescription.
Yes,
throw some light in terms of what are your reflections about why that might be the case.
Ma'am, I categorized into those who went for professional care and those who did not go for professional care. So that medication without prescription is coming under those who did not go for professional care. And the other one is those who went to allopathy is coming under professional care. So they are different categories, ma'am.
Thank you.
Thank you,
Dr. Aradhana. The next speaker, Dr. Vaishnavi. Any questions for Dr. Vaishnavi?
Dr. Hema this side. So Vaishnavi, I would like to know that, have you thought of doing the study on occupational therapists suffering from migraine? I mean, you mentioned in your study that there are a lot of medical professionals also suffering from it. 70%, more than 70% of them come to tertiary care. So,
Sorry, ma'am, I would just like to add that
Yeah.
I added a fact that more than 60% of healthcare visits are due to migraine,
right.
in headache care centers.
Right.
So it was not on the professionals, it was a data gathered by the patient, like of the patients.
Got it. But then do you plan to do, in your implications or in your future, because there are a lot of working professionals, we all are, and many of us do suffer from migraine. So that's a suggestion in fact that yes, you should be doing this with the professionals so that, the studies which you people do can be helpful to the fraternity.
Yes,
Thank you.
ma'am, thank you for the
Thank you.
suggestion.
Thank you for your suggestion.
I-
Bole madam wants to ask.
Thank you. I'm Dr. Bole from New Delhi. I have a question and plus a suggestion. You said you talking about migraines, and did you think about positioning when you did the manipulation for the migraine? Do you think about the cervical pain ever causing the migraine? Positioning, work positioning?
Yes, ma'am, that could be one of the reason, but it was not under the scope of my study that I was
Yes.
undergoing that.
Yes, because that has been my sphere of work too, and your work, whatever you said, was two things I would like you to remember: the cervical, the work position of the person she does, bending forward, and did you ever use a cervical collar?
No, ma'am.
Yes. That gives a very comfortable, I do not like the commercial cervical collar that they give for the neck. No. I would prefer to make my own and give it to my patients, and that's more comfortable.
Thank you, ma'am, for the suggestion.
you.
I am actually planning to take up an intervention after
Yes.
this. This was the
Yes.
prevalence so that I can know whether the myofascial release I
Yes.
can use as an adjunct to the conventional occupational
Exactly,
therapy intervention patterns.
Thank you,
You're
Dr. Vaishnavi. And Dr. Hema, I wanted to add to your question, the answer to your question that research is being done in our institute in LTMMC Sion on medical students and occupational therapy and physiotherapy students. So we are collecting the data. We'll publish it soon. Thank you.
Hello. Most of these migraine patients, as she has pointed out correctly, most of them will have neck pain. Most of them, because that is my experience for the last 50 years. Most of them will be associated with this neck problems also. The working position in which they are doing.
Yes,
so
sir, correct.
we have to study that also.
Yes, sir.
Along with that.
Thank you. Thank you. Now,
Only one suggestion. We should also study vestibular involvement in migraine.
Yes,
With
yes.
Right, so that is a good suggestion. Thank you.
Thank you all for your suggestions. Now to summarize, I will really appreciate all the presenters that you have started thinking about the different aspects which can also be a part of our intervention, like studying about the digital dependence, the migraine, how it affects your day-to-day life and how the quality of life is affected. So I really appreciate. Only a few of the things I would like to point out is when you are taking a wide age group, you can divide that age group into the different parts, and then you can analyze because you cannot generalize 20 years person's difficulties with 50 years person's difficulties. Especially in case of housewives, it is every age group has a different problem, so you should think about it. Also about the handwriting difficulties, development of the dominance. As the question was asked, So you should be aware at what age you should see the laterality development. So such few things you may consider it during your further research. Thank you.
Yeah, so to summarize from my end, keeping in perspective the theme of the session, that is foraging the context of occupation, all the 7 presentations had something with respect to occupation. Like say one presentation where sleep deprivation was spoken of, meaning there was lack of occupation. The one presentation by Abhiram was like immobilization, again lack of occupation. There were 3 presentations which were speaking about overuse of occupation, that is WhatsApp dependency or like awkward postures and overuse. And 2 presentations by Raghuram and Harini spoke about handwriting and hand preferences with respect to occupation. So all the 7 presenters spoke something with respect to occupation in the context of the session theme. And at the same time, from research perspective, there were different study designs which were utilized in all the researches. That is, there were observational studies, there were interventional studies, as well as systematic literature review. And I would appreciate Dr. Deepak's systematic literature review study. It was like quite systematically done, plus there was critical appraisal of the studies included. Only my suggestion is maybe in the end you could have summarized the outcome of these 9 studies, and maybe if feasible to say that what would be your literature review recommendation, level of evidence as well as the grade of recommendation. But overall the papers were very good and all 7 of them completed their presentation on time. Thank you.
We'd request the chair principal to please hand over the certificates to each of the students. Dr. Harini D. Dr. P. Raghuram. Dr. Deepak Vignesh Raj. Dr. Abhiram U. Dr. Bhavita Sharma. Dr. Aradhana Naik. Dr. Vaishnavi Joshi. Now I'd like to call upon Dr. Joseph Sunny on stage to kindly felicitate Dr. Shailaja Jeevan and Dr. Punita V. Solanki.